tonight we're talking about chiropractic care, auto accidents, pain management, and we were so lucky to get the best of the best. I have the best chiropractor in South Florida. Let me welcome Dr. Howard Dinner. Dr. Dinner, I got to tell you, there are so many people here in South Florida walking around, whether it's knee pain, shoulder pain, lower back pain, and they don't think that anything can be done about it because they take these pharmaceutical painkillers. First of all, right. You're not going to give them pharmaceutical painkillers.
No, we don't prescribe medication, nor do we need to. And if we do, we would refer a patient to the appropriate doctor who would evaluate a patient for pain intervention and or narcotic medication. What we do is all natural. It's safe. It's probably the safest thing in all of healthcare is chiropractic care. Not to say accidents don't happen or haven't happened. You have to reveal that everything has some risk, but chiropractic for the most part is the safest procedure in all of medical care. We don't put anything in, we don't take anything out, we don't stick anything in, we don't put any substances. We allow your body to heal itself by removing impingements, impingements of nerves, impingements of blood flow, impingements that exist that prevent the nerve energy or the blood flow from circulating properly and thereby relieving the pain. What we look for in chiropractic is distortions in the structure. If a person has a distortion, for instance, in the spine, which could be causing a pinched nerve or an inflammation of the joint or of the nerve or the muscle, the tendon, we locate that and we treat that. One of the procedures that we use is spinal manipulation, but we use a variety of other therapeutics in addition to spinal manipulation, which include physical therapy, exercise, massage therapy. I personally implement acupuncture as well with many of our patients and their conditions. And we also use a very special kind of technique, which is called spinal disc decompression, which is something that has been developed over perhaps the last 30 years to relieve pressure on spinal nerves caused by herniated discs or variants of herniated discs. And it's a highly effective technique and procedure which is painless, and a patient doesn't experience the snap, crackles, and pops of a traditional style adjustment. It puts their spine in just a certain position, whereby when we pull and separate a person's spine, for those who are watching, you can see on the video, otherwise I'm just going to describe it, where the spine is pulled straight. And what we're able to do by doing that is to rehydrate the disc to a point where the separation between the vertebrae becomes greater.
Gotcha.
And by increasing that and milking it, it gets an opportunity to heal. And the pressure that exists on the nerves becomes reduced because the spacing is bigger. And research has shown that it is a permanent situation. And Many compliant patients do see changes on their MRIs, which can be documented. It's not an instantaneous procedure, but it is something that helps reduce the pressure that happens around the nerves. And the pressure on the nerves is the one that causes the radiating pain, the pain that travels, the pain that goes down the back of the leg, which is a sciatica, the pain that goes down the arms, which is called a neuropathy, as well as it's also a radiculopathy. So that's
Dr. Dinner,
really what we
how do
do.
you, what can you do for someone who has arthritis?
We can help reduce what we term the subluxations, the distortions in the vertebrae. If you have arthritis, arthritis is causing an irritation, well, in the joints. The joints roughen. That's essentially what happens with arthritis, and the discs and the cartilage gets rough. And sometimes the bones tend to overgrow as well from postural distortions, injuries, genetics, other nutritional deficits along a person's life can cause arthritis. And by reducing the other components of what's happened in a person's, for instance, neck or back, we can give a person with arthritis significant help.
Wow.
And because there's more than just one component. And
do you, Dr. Dinner, do you see doctors, MDs, being more open to chiropractors now than, say, 20 years ago?
Absolutely. There's a lot of cooperation between the medical community and chiropractors. We have total access to people's health records in hospitals and other facilities, MRI centers, laboratories. When I started in chiropractic about 35 years ago, that was not the case.
Right.
And even which was the most ridiculous thing, is there were medical people who wouldn't accept a referral from a chiropractor, and that was detrimental to, of course, the patients. And those are the people who are supposed to be cared for, at the utmost and at the at the highest level. And when we used to attempt to refer to some medical people, we were rejected, and but that doesn't happen any longer.
We just got a text. Somebody wants to know, do you accept Medicare?
Yes, we do.
Okay.
We accept the traditional Medicare as well as some of the Advantage plans.
Okay. Actually, she wanted to know about Humana Gold.
Yes, we accept many of the. I'm not certain about Humana Gold or any insurance in particular. That sounds like an Advantage plan, and that would have to be checked out by the office.
Right. But they would still have to get whoever their provider is to give you a referral.
Sometimes.
Okay.
Traditional Medicare does not require referrals, and nor does any other health insurance companies do not require insurance referrals. There are some circumstances where a referral is required from a primary doctor, but not many.
Well, we just got another text here. Okay, so they want to know, who's the first person I should contact when I'm in an auto accident, the attorney or the chiropractor?
The chiropractor.
Okay.
They should seek chiropractic and/or medical help first. The attorney is somebody you see if indeed you want to pursue a person who did you harm. But first, you get your injuries evaluated, because if you have injuries that will heal, you really have no, case against anyone except for some pain and suffering. But I think, and you want to go to seek attention,
Right away.
medical attention, chiropractic attention right away, and don't wait. In our state, we have what's called a 14-day rule,
Right.
which means it is what it is.
You
but
got to get
if
in
you-
within 14 days
You gotta
if you
get
want
within
it covered.
14 days, get evaluated, get it documented that you've been involved in an auto accident, and if you're not really in much pain and you don't, want to pursue treatment, just so that you've been evaluated, is critical. What happens is many people wait to see if they get better. Nature heals them. They're sore in the neck. They have a sore low back. They're achy, but they don't want to go seek medical attention because, they figure what could possibly have happened.
Right.
They have a few muscle spasms, and they wait and they wait and they wait. And a couple of months later, they're in severe pain. They wake up one morning and they're in pain. And now they're seeking attention under their auto plan, because what else could have possibly happened? Nothing else happened. And 5 years ago, that was okay. But in the insurance company's attempt to control things, legislation was instituted to make it 14 days, and we know from experience that it is 14 days,
Okay.
no more.
We're going to go to
And,
break. I want to talk about auto accidents when we get back. The name of the practice is Community Health and Wellness Center. Dr. Howard Dinner. He is one of the finest. He's one of the finest chiropractors in South Florida. Give everybody your phone number. I love this number.
It's 954-370-PAIN, which is 7246.
Boy, did you get lucky on that one.
That's true.
That's perfect. We are back. This is the Ask the Expert show. We're on every Monday and Thursday from 6 to 7 with South Florida's finest businesses. We want to be able to educate you for the finest. It doesn't matter if it's health, legal, financial, or home improvement. Tonight, it's health. And we have one of the top chiropractors in South Florida, Dr. Howard Dinner. The name of his practice is Community Health and Wellness Center.
We're in Plantation, by the way.
You're in Plantation, but you're easy to find. You're right there on University. I mean, I found it with no problem. I could have gotten there with my eyes closed. So it's it's a great location. So I got to ask you, is there really a such thing as whiplash?
It's a colloquial term.
Okay.
It's hyperextension, hyperflexion. It's when your neck moves forward fast, whips back and forth, and it tends to damage the ligaments. Today's cars are better. You have seat belts, you have head restraints. But if you're not sitting back like this when you're driving,
right,
and you're sitting like this, right? You're sitting and you're moving and you're relaxed, and you get a bump, and back goes your head, and it goes forward, and you still can get what's called whiplash.
How do you determine that?
From X-rays.
Okay.
X-rays give a good indication of whether or not the ligaments have been damaged. We evaluate the alignment of the spine very carefully. and we can see the distortion that exists because of an injury like that. The bones move out of place. And just imagine if your thumb was dislocated or just separated just a little bit, how much pain that would cause you.
Right.
Well, that's why a whiplash is so serious.
And
And
usually
putting
happens
it
in
back
an
in
auto
place,
accident.
yeah, or other things that cause that,
Okay.
a sporting
That's true.
injury, right? Football examples, football or other contact sports, that the neck and the head are vulnerable. Um, they could very seriously be injured, and when the ligaments are injured, the stability is affected. So if that's not addressed quickly to the point where it's put back in place and the ligaments, and we do procedures to promote healing of the ligaments and strengthening the muscles, um, uh, a person tends to have issues the rest of their life.
Okay, I'm going to ask you a question. I was listening to a talk show this morning. The host just turned 50, and he said his knee was hurting him. And he was talking about, wow, is this what happens when you get older? Now, I'm a little bit older than he is. Why is it all this pain starts when you start getting up there in age? Things you
Right,
never had a
because
problem with.
right, because you're aging. The aging process is essentially your body doesn't respond and heal as quickly. So you get little minor injuries uh, superimposed on the degenerative changes that exist, such as arthritis starting to form, and the body's slower ability to heal, which is why as we age, our skin tends to sag. We tend
Right.
to it's not as vibrant. We just don't turn the cells over as quickly.
Okay.
So,
That makes
you
sense.
know, yeah.
What, as a chiropractor, now I know you get a lot of auto accidents, but you have to get a lot of low back pain. I hear more people complain about low back pain and they don't know what to do about it.
Okay. We actually see a whole variety of patients and all kinds of conditions. Auto accidents aren't the most, in my practice, is not the greatest percentage of people.
Okay.
It's ordinary people with ordinary problems. Neck pain, back pain, sciatica, herniated discs, conditions that affect the whole population. And there is help for them um, with gentle chiropractic procedures to correct the misalignments, deal with the misalignments, the imbalances, the tissue imbalances, the muscles. We deal with headaches, a lot of headaches, um, where people have stress headaches and
Migraines, you
nerve
deal with
headaches,
migraines?
migraines. We're able to help all these people naturally, without medications, without which have their side effects and some danger. We're able to help the average person, not necessarily just the auto people or the people who've gotten hurt on the job or people who've had sporting accidents or falls at home. We see mostly what I call just regular neighborhood people.
You know, it's funny you said about work related injuries. I have spoken to more people who got hurt at work, and their companies sent them to a chiropractor rather than an MD.
That's correct, because chiropractic is quick. We are able to get people back to work very quickly, And because what we do is physical. And if you have a physical problem, we deal with it physically, not necessarily throwing chemicals at it, which is what medication does. In some situations, medication is needed, but we do integrate that when it's necessary with other practitioners.
You hear all the time that if you can keep from having back surgery, you should. You should not have it. And
That's
I think
correct.
that's where you come in, because yours is non-invasive, and at least they should give it a shot before they think about doing surgery. Because the people I've talked to have had back surgery, they've had problems all their life since the surgery.
Right. Statistically, I believe back surgery is 50-50. As far as in 5 years, 50% of the population will have their problems back. And back surgery should be avoided as definitely the last procedure that is utilized by a person. They should use all the conservative methods, which chiropractic is at the top of the list for
Right.
conservative methods. And most of our patients, I would say about 85% of our patients get the results that they came here for.
They didn't have to have the surgery.
They didn't have to have surgery, and they didn't have to have medical intervention.
Can you look at someone's x-rays and tell how much you can help them? Say on a lower back?
We get a good indication as to what our expectations are for a patient based on the condition of the spine, how serious the misalignments are, if there's ligamentous damage, if there's indication of a disc problem, for which if we suspect a disc is involved, we would refer a patient for an MRI to get a definitive diagnosis. From all of those components, from the blueprint, so to speak, of a patient's spine, we can give a person a good indication of what to expect, how much treatment would be involved. It's not necessarily how much pain a person is in or perceives of themselves being in. It's more what the findings are that determine how much care a person would need. So somebody who presents themselves in severe pain and has what we call clean x-rays can expect to recover rather quickly because there's no concomitant conditions going on as well.
Dr. Denner, give everybody your phone number.
954-370-7246. That spells pain. If you don't, I'm not writing it down. 370-PAIN. We're at University Drive in Broward Boulevard, north of Broward. And we'll provide a free consultation to those people who are, want to find out if they can be helped, if there's help for them.
Dr. Denner is the best. He'll be back with us again next month.